Hello, everyone. A very warm welcome to all of you. And thank you so much for taking the time to be with us here for today's webinar. My name is Diya Ranjan. I'm the marketing manager at Bizmatics, and I'm the organizer for today's webinar. In today's webinar, telehealth workflow from start to finish, along with coding and billing, our experts will walk you through the entire telehealth workflow as it unfolds in the software. They will also update you with the changes in the billing and coding in light of the COVID-19 pandemic. So through these ongoing trainings, we would like to assure you that we are there with you to help you, to support you in all the efforts and hard work which you are putting through during these difficult times. Let me introduce you to our presenters for today. Our very first presenter, Siddhi Une, is the Director, Implementation and Content Management at Bizmatics. Siddhi has over 12 plus years of experience in Bizmatics, and in her tenure, she has successfully conducted 300 plus implementations for various clinics, both in the East as well as in the West Coast. Our next presenter, Kristen Neck, is the Vice President, Revenue Cycle Management at Bizmatics, and Kristen has over 20 plus years of experience in Bizmatics, and her billing expertise allows her to guide, analyze, and provide valuable feedback to practices. Kristen also conducts billing analysis to help improve the financial health of medical practices. Thank you to both my presenters for sharing these valuable information with our attendees today. And a few housekeeping items before we begin. We have a question and answer session at the end of the webinar. So please type in your questions and send it to us. We will answer it in the order it comes. A recording of today's webinar will also be available. It will be available in our resource center, and we will also share it with you via an email. So it will be available for your reference later. So let's begin today's session. Siddhi, it's over to you now.
Thank you, Diya. Hello, everyone. I am Siddhi Une. I will be presenting telemedicine visit workflow with combination of few slides and live demonstration. It will be a step-by-step walkthrough. I hope you will enjoy the webinar. We are so glad to have you all here. Thank you for joining. We really appreciate your time. So let's get started. So we are all facing COVID-19 pandemic situation, and it brings extreme importance and lot of attention to telehealth. It is a safe, convenient, and secure way to manage patients' care. You can certainly limit the exposure by implementing telehealth in your practice, and you can reduce the risk of exposure to you and your clinical staff. So let's take the advantage of promotional offer. So Prognosis is offering 3 months of free subscription. So you can definitely want to take the advantage of that. So let's say, how do I sign up for telemedicine? So you can send an email to sales, do the required paperwork, get the Zoom Pro account. We highly recommend Zoom Pro account, which is HIPAA compliant, and setup and training time is approximately 3 to 5 business days, even less, because our team is really working round the clock to get these setups ready as soon as possible. So how do I know if telemedicine is turned on in my database or not? So recently we have added a telemedicine indication on the information icon. So you can see there is an information icon I, and you can see here telemedicine is on. You also see some of the other modules which are turned on or off in your practice. So if you have not been to this screen, certainly you may want to get and see it. So once the telemedicine is turned on for your practice, you will see some changes on the home page and the configuration, and we will go through those changes during the live demonstration. Likewise, you will see some changes on the home page. You will see the camera icon, which indicates it is a video consult, and you have to turn on some filter options under filter here. And then you can add a telemedicine column under selected columns. Each user has to set up their home page for telehealth, and we will do the live demonstration. I will walk you through how you can set up your home page. Then we will go over with some camera icon color coding, because this is a new icon you will see, and you certainly want your staff to get familiarized with that. So yellow icon stands for meeting is initiated or it is in progress. Gray icon indicates meeting is over. And blue icon, the dark blue icon, says it is upcoming video consult. and light blue icon indicates this meeting is not yet ready, because we have a 15 minutes time clock set. So just you can start any meetings before 15 minutes. Then we will go through the telehealth visit workflow from start to finish. So usually it starts from appointment scheduling. We will walk you through email and text functionality. We will go through the patient check-in process and copay and consent signing. Then we will also cover the physician's workflow, clinical documentation, patient checkout process, and how you can close the encounter. And we will also cover coding and billing. So here are some steps for appointment scheduling. It is same as you do your normal scheduling. You just have to double click on the time slot and select the patient's name, date and time and the provider. But the two important fields you have to select is the encounter type as telemedicine, and you can see there is a camera icon shows up, and you want to select the telemedicine visit or telehealth as the location. So for telemedicine, because it is over the web, email and cell phone is mandatory, because we send email and text notification and the Zoom link is added in that text, so patient can join the Zoom session. So patient gets text and reminders, and these are the instances. So patient will get the first email and text reminder as soon as appointment is scheduled. Then the second reminder goes out day prior. Then the third reminder goes out 15 minutes prior to the appointment. And we also send another reminder for the ongoing consult if patient does not join and doctor is already on the meeting and waiting for patient. So here are some snapshots you can see. This is the example of email. This is the example of text. And this is the example of email where ongoing consult. So doctor is waiting. It says your video consultation with Dr. Welby has been started. Then we will walk you through the patient workflow on the mobile device. A patient can join a Zoom session using laptop as well as a desktop, tablet or a cell phone. So he can click on the Zoom link from his cell phone. So you can see, so I have opened my email on my cell phone and there is a Zoom link. And then if the patient is first time user and new to Zoom, then it is going to prompt them to download the Zoom app. But again, this step is only first time. For the returning patients, it is very quick. So you can see here, if it is a returning patient, then you can just click on the Zoom link and it directly places you in the waiting room. And as soon as doctor joins, patient can enter the name and connect the internet audio, and then the call is initiated. Then we will walk you through the patient check-in process. How do you mark telemedicine appointment arrive? And then some of the options we will discuss on copay collection and also the consent. Then we will walk you through on the physician's workflow, like in a single click, how physician can or how doctor can start the meeting. And you can see there is a sample picture here where doctor is here and the patient is here and ongoing consult is going on. And on the left hand side, you can use the table of content. You can use your existing forms and templates to finish the progress note. Then these are the things from physician's workflow. You can use the table of content and templates. You do the documentation similar to as an in-person visit, document the assessment and plan. We will also cover evaluation and management codes and what are the modifiers required, if required or not. And then you can, and I will also walk you through how the doctor has to click on leave meeting, and then it ends the meeting for everybody, but doctor can still come back and finish the charting later. So you do not have to do everything in the real time. So here are the how doctor clicks on the end meeting. So there is a leave meeting option on the right hand side bottom, and as soon as physician click on that, then this pop-up comes up and you click on the end meeting, and then the video consult is done. But the chart is still open and you can do the documentation later. Then we will also walk you through some of the clinical documentation guidelines as we have learned. Like your progress note should indicate it was a telehealth service. Then it should also indicate the location of the patient, like patient is at home or a nursing care or something like that. then duration of the visit. Then you can just do the documentation as you do in person, and the physical exam is optional, how you enter, or you can have your patient to do the self physical and enter those details. And here is the progress note. So once you are done with the documentation, you can review the progress note. I will also walk you through the My Notes feature, how you can quickly edit the progress note and sign off on the chart. As soon as you sign off on the chart, then the status of the visit says completed, and then the camera icon turns gray and the claim is created. And here is the sample of claim. So when you go to the claim screen, and if you use prognosis billing or you may be our revenue cycle management customer, advantage of selecting location as telehealth visit, it automatically connects to the place of service 02. So your biller does not have to keep checking it if 02 is selected or not. So that's the reason we highly recommend you select telehealth visit as the location while booking an appointment. And then here is your regular evaluation and management code. And we will go through these codes, like what are the new patient codes, established patient codes. Then what if my patient does not have a camera or a smartphone? Can we do audio only visit? So we will walk you through on some of those coding guidelines. Okay, so now let me go ahead and get started. And I'm going to go ahead and log on to our one of the test environment. So I'm logged in here as a Dr. Marcus Welby. You can see that. And here under info icon, let me show you that indication. You see here telemedicine is turned on. Now let me walk you through how you can set up your home page. Few easy and simple clicks. So just go to the filter, and wherever you see the visit type and there is a camera icon, that means it is a telemedicine encounter type. So let me go ahead and check some of these encounter types. And then I have two more locations here. I'm going to select those. Then I go to the manage columns, and I see a new column here, telemedicine. I want to add that in my selected columns, and I may want to place that next to the patient and just click apply. And as soon as you do that, you can see that camera icon shows up. Okay. Then you can also do show telemedicine appointments only. So check that. And it is going to only show you today's schedule for telemedicine. But if you are doing combination of both the patient, regular patient as well as telemedicine, I would recommend you can keep it unchecked. So these are the settings you have to follow or do it on the home page as soon as our tech team says that telemedicine is turned on for your practice. Also, we recommend to do this step for each clinical staff. So everybody should do it because now you can have customized homepage per user. Now let me go to the appointment and schedule. So few simple steps how I can make appointment. Just double click on the time slot. Automatically date, time, and the provider is selected. I just have to choose a patient. So let me just select a patient called Dodana. And here in the drop down, you see telehealth as the location. Encounter type, I'm going to select telemedicine. Okay. And any additional details you can type here. Something of that nature. Now I'm going to go ahead and click schedule. It says provider is not available at this location during the selected time. Why I'm getting this error? Because when the new telehealth location is added in the system, my work pattern is not set up for that location. That's the reason I'm getting that error. So when your telemedicine setup is turned on, you can always go and set up the work pattern. For example, you have the schedule Monday to Thursday, and then every day 2 hours you are going to do only telehealth visit. Or if you're undecided about your work pattern, then you can simply do any time and go ahead and click schedule for now. And later on, as your work pattern confirms for telehealth services, you can come back and set that up. Then I would also like to go over a little bit on overload no and yes functionality. We do not recommend a double booking telemedicine appointment, because let's say you have 11 o'clock appointment for 2 patients. Doctor cannot be in a video consult with both the patients simultaneously. So one patient has to wait. So that's the reason, though the system will allow you double booking, we recommend not to double book. So let me go ahead and click schedule. Okay, let me do one more thing. I'm going to go ahead and add a new patient here. And hopefully this patient does not have the phone number and email, because the patient I earlier selected looks like had the phone number and email already programmed. That's the reason I did not get that. So here you go. So if patient does not have the phone number and email on the demographics page, you are going to get this kind of an error. So I'm going to go ahead and say yes. And I will quickly add details here. I'm entering my cell phone number and email address. And then I'll go ahead and click anytime. And there you go. So the appointment is scheduled. You have the access to the demographics page, and you can see that allow text messages on cell phone is automatically checked. Okay. So you do not have to come back and check that manually. As soon as you enter the cell phone number, we have already taken care of. Also, if you do not have the text reminder service turned on for your practice, but if you sign up for telemedicine, text reminder is included in that for first 3 months in the trial. And we will be sending the text messages for telemedicine appointments only. Then here you have that little camera icon, and you see there is a meeting ID associated. So per appointment, there is a unique meeting ID gets generated. And if you click on it, you can also easily copy the meeting link. So along with the doctor, if nurse or a MA is going to join that conference, you can always, they can always use this link. So this is the way. So we have tried to keep the workflow very simple. So there is no additional learning curve for your staff. Only mandatory thing is email and cell phone number. And then the telemedicine is the encounter type you select. And the location you select as telehealth, because 0 to place of service is critical to be on the claim. And the camera icon shows up here for the telemedicine appointments. Now let me go back to the home page. And you can see these are my patients. I'm going to go ahead and just make it simple, because our telemedicine is focused for today's training. I will just check show telemedicine appointments only. So let's say, so in today's demonstration, I'm going to have Kristen to be my patient, and we will do the live consult. So here is she, and you can see her appointment is at 11:15. There is a blue color camera icon, that means it is ready to go. And here is the reason for visit. She is coming in. So now the first thing I have to do is I have to check in a patient, because in this short setup, a patient is not going through the portal. We are sending the link via email and text. So we really don't have a way to get the return message if patient is arrived on the meeting or not. So here is what our recommendation. You can just go with the protocol and based on the time. So just 5 minutes before the appointment, you can check in a patient. And when you book an appointment for a patient, you can also tell that to patient that please be ready 5 minutes before your consult. Okay, so I'm going to go ahead and mark her arrive. And your staff can do it, doctor can do it. So now it is, you see the status of the appointment is arrived. Now the next step is copay and the consent. So in COVID-19 situation, consent is not mandatory, but it is certainly recommended. We do have a consent form added. Just I'll show you an example. Something of that nature. If patient goes through the patient portal, then he is able to or she is able to sign this consent form electronically. But if patient does not go through the portal because accessing the link directly from the email or the text, what we recommend, you can document a verbal consent in the chart when you are preparing the progress note. Okay. Then how about the copay collection? So there are a lot of rules and regulations are relaxed due to COVID-19 situation by Trump administration. So some insurance companies copays are waived. So you can check those guidelines and state specific insurances on their website. But if you still want to go ahead and collect the copay, if there is an applicable copay, then you do the same way as you do in the clinic. For example, patient walks to the clinic and you run the credit card. So instead of swiping it on the machine, you may want to take that information over the phone and collect the copay. So let's say my copay and consent is done. I'm going to go ahead and click on the patient's name, and I'm a physician, Dr. Marcus Wilby, will be doing this will be doing this video consult with Kristen. So in a regular non-telehealth visit, you would be always clicking on the patient's name and it takes to the chart. So this time I'm going to go ahead and click on the blue camera icon. Okay, you will see one difference here. On the right hand side, my third pane panel is opened up. Okay, this is a new feature we have added. It is available only for doctor, this third pane and video meeting option. So it enables you to do the video call with the patient, as well as you can have access to documentation on the left hand side. So now I see Kristen is there and I can place myself here. I'm going to just do phone call. I don't want to use computer audio, but in real consultation, you can use the computer audio because now most of the computers has mic and speaker and also the camera. If your computer does not have the camera, you can use the tablet and use the Zoom app on that. Or if you do not have the mic and speaker to your computer, you can always do the phone call. So when you click on the phone call, there is a phone number to dial, and then the patient and you both can get connected. So I'm just going to do phone call for now. Let me just expand this and close this. And there she is. So here is Kristen and me as a pretending physician, and you can have that dialogue initiated. On the left hand side, you can use doctor forms. You have access to your patient forms. You also have access to the document list. For example, this is a follow-up on lab or something. So I can quickly see my lab results or radiology results. Then you have access to the vitals. Of course, patient is not here in person, but let's say she is here for a fever and then you can, if she has done the home temperature at home, you can document it and make the remarks related to that. Then go to the HPI. So you follow the same steps as you do in the clinical documentation. You can copy some of the data from the previous visit. So now here I just pretended like COVID-19 concern, and she has a fever and body ache and worry about that. So you have this template. Also, based on the CDC guidelines, we have added a new COVID-19 questionnaire here. So I'm going to go ahead and just show that to you. If you do not have this questionnaire in your database, you can certainly request it. Okay. So it asks the signs and symptoms, and also it has a travel history related questions. And you can see this questionnaire we have created based on the CDC guidelines. So if you do not have it, you can request it from the resource center. Then you can do the assessment and plan everything the same way you do the regular visit. But let me go ahead and focus a little bit on E&M because that's the most commonly question. So I'm going to go ahead and click E&M. And here we have 4 new E&M. So the first one is the new patient, which is same as you use 99201 to 205 and 99211 to 215 for the established patient. You can see that some commercial insurance need modifier, and Kristen is going to go over in detail on the coding and the billing guidelines, but I just wanted to quickly show you. Then there are telehealth audio only. As I said, what if my patient is in rural area, does not have internet, and only phone is available? Can I still do telehealth? So you can do the phone consult, and these are the codes. These codes were not, I think insurance companies were not paying before, but in this COVID-19 situation, they have been. Then you can see transitional care management, some of these codes. Also, you can see telehealth new codes. So there were few codes introduced in 2020, especially for telehealth. And then there are some G codes which you can find under HCPC. So if you go here, you can find those here. I think G20, 12, and Kristen will go more in detail on that. Once you put the code, then you can also add the modifier from here. So let me show you. So let's say she is an established patient. I'm going to code is 99213. Okay. And then I'm going to go to the assessment and go to the CPT. And if there is an applicable modifier, I can go ahead and type. I think there are two. There is one which is 95 and there is one which is GT, interactive telecommunication. You can enter that and simply save. So let's say my ongoing talk is done and I'm done with my ICD. So I'm going to also show you there are a few new codes for COVID. I don't know if you have seen check those, but we have those. We have updated our code master, so you can see those. So let's say I'm going to put something. This is an example. Okay, so those codes are also there. You have the plan and you can document it here. So you do not have to finish all the documentation in real time. So once your video consult is done, then I can just go ahead and click leave meeting for now, and then I will go ahead and click end meeting. Okay, so my call is done. Now no more, we are not saying it's done. So I'm going to go back to the home page. Okay, and this camera icon, which was dark blue before, it is gray, and if I hover the mouse, it says meeting is over. Okay, but the status of the visit still remains with doctor. But what I can do, I can use my workflow. I'm going to go to the patient workflow and I'm going to drop it down as video consult done. If you do not see this workflow, these are some custom workflows you can create. Some of you may be familiar how to create that. And if you don't, then towards the end of the session, I will walk you through a little bit on the configuration and I will show you how you can add these custom appointment statuses. So I'm going to go ahead and mark video consult done. And let me go ahead and click OK. And you can see here, this is done. And then I'm ready to go and take a look at my next patient. Maybe she is at 215, so it is not ready. You can see that red cross. So let me go over one more time on the camera icon color coding. This is meeting over. These are some of the upcoming consults. Maybe this never started, so you can see that. And then blue icon or light blue is not yet ready because it is far away. Okay, so it's 2:15 and 3 o'clock, so time is not yet there. So this is the way you can do the ongoing consult with a patient. Few simple steps: just mark patient arrive. If you do not mark patient arrive, then patient will get a message on his side that waiting for host. So mark the patient arrive, then as soon as patient gets in the waiting room, and then doctor can click on the camera icon and then you both get connected on the video console. So there is a one progress note I have created just as a sample purposes, and I'm going to show you that one. Maybe this one. So let me go ahead and click on that. Okay, so here you go. So let me show you how I can edit the progress note. So let's say there is a default progress note comes up, and then I can click here. Okay, and then I can recreate my progress note from the default. And then this becomes simple typing. So it is a free text. So I can add anything or update anything. And I just created a sample progress note. I can see, my assessment and then plan and then my, E&M code and everything. Okay. One important thing I would like to point out here is duration of the visit, the location of the patient, and encounter type. So what I'm going to do, I'm going to show you one brief progress note. Okay, so on this progress note, you see the patient info header where you have the visit type telemedicine and the appointment location is Telehealth Elcro, and it also has the appointment location address. So we can also customize your patient info header for telemedicine visits where we can add these things. So if you are interested, let us know. You can always send a request from resource center and we will be able to help you, because it is kind of recommended to have the visit type and the location of the service on the progress note. Okay, so once I review my progress note, I'm done with my all the edits. I can go ahead and click save, and then I'm going to go ahead and do encounter close, and my claim gets automatically created. So I'm going to go ahead. If you have any meaningful use stuff and everything, those pop-ups will show up. And now my chart is done. I'm going to go ahead and show you back to the home page. And you can see Donna telemedicine. And now the status, earlier it was video consult done. And now it is completed. So now let me go to the billing side. And you see here Donna, and then there is a status here ready to bill. So let me take a look at the claim. So I'm going to go to the claim details. And here all my ICD showed up, then my CPT code. And the important thing is location. I see the telehealth as the location and it automatically connects to the place of service 02. So if you do not select telehealth location, then your place of service is going to be 11 and then your biller has to manually change it. Okay, so that's the reason we recommend you select telehealth as the location. So now question is, now let me go through some of the configuration stuff. So I'm going to go back to the EMR side and go to the settings and configuration. So can I have more than, so when we turn on your setup, you will get one telehealth location and you will get one encounter type as telemedicine. So can I have multiple telemedicine encounter types? Yes, you can. So if you go to the encounter types, okay, you can add or create new encounter types. So let me go ahead and open the existing one. It looks like similar to your other standard encounter types, but the only difference you are going to see here, there is a checkbox which comes up telemedicine appointment, which you have to check, and that's the indication and creating that Zoom ID and everything. And then you see the appointment color. So if you want to change some, give a specific color to that, you can just customize it for yourself. And then make sure the text reminder, this default radio button is checked. If it is not checked, then your texts are not going to go out. So make sure by default, as soon as you click add new, then the default is selected, but just keep an eye on that. Then the telemedicine visit, it should be more than 5 minutes. So we would recommend at least put 10 or 15 minutes. And then you can connect the detailed progress note for that and edit it. Or if you want to have a customized progress note for telemedicine, we are here to help you and we can create that for you. If you have any template, you can send it to us and we will be able to help you to create that. So to add a new encounter type, simply click on add new, do the abbreviation of the code and enter the details. Make sure telemedicine appointment is checked. So for example, if you have a pain management practice and you do personal injury as well as workers' comp and the regular pain management, then you may want to have a 3 separate encounter types because maybe the progress note is a little bit different. Then I'm going to go to the configuration and locations. So by default, when we turn on the setup, as I said, you will get one location but I can definitely add more locations. So just click here, add new, and create it. So what is the location I should choose, when I'm practicing telehealth? So if it is a multi-physician, let's say it is a multi-physician practice, and each physician is going to be a different location for telehealth, then you may want to have those multiple locations added, and in the bracket you may want to enter the name of the city or something as an identifier. And then time zone is going to be the same as your other locations, and the place of service is 02, and you put the same NPI number for that main location, and you enter that address, because this information will show up on the box 32 on the claim form, and we want to make sure it doesn't go blank, because we do not want to have denials, right, for your claims. So you want to make sure you enter that those details. All right. Then I'm going to go back to the configuration, and I will also show you how you can create that custom appointment. So let me go ahead and click here. It is under codes/drugs, custom appointment. Okay, and I can create one. So let me just say meeting done. Okay, and then I want to display it as a meeting done. I think it takes few characters, so I'll just put like that. Okay, and then here we have some fixed statuses in the system, which we call it as a system statuses. So you have to connect this custom status to one of the fixed system status. Okay, so usually when the meeting is done, that means patient is kind of ready for checkout. But because patient is not physically present in the clinic, there is no checkout process as such. So you just mark it as a, you can connect that with the system status as ready for checkout. And let's go ahead and click save. Do not worry about the code. Do not worry about the sequence number. Now, if I click on these 3 dots and go to the workflow, I have meeting done. You can use this, doesn't necessarily for telehealth, but if you would like to create few custom statuses for your, if it makes, easier patient workflow, and you can change those statuses here. So staff knows what's going on, this is visit is done, this patient is arrived or waiting in room, whatever, you can make those different statuses. So I think that's all, just wanted to go through the live demonstration. So we covered how to set up the telemedicine, what are the changes on the home page and on the configuration side, how I can quickly book the telemedicine appointment. If you want to set up the work pattern for your location, you can always go to the work pattern and select a doctor, date and time for your telehealth, services when you are starting. And then here you can select the telehealth as the location and set the time, start time and end time. Then email and mandatory is email and phone is important. And then different text messages goes out. And then we walk through all the physician's workflow. Make sure you do end the meeting before you go away from that screen, because otherwise your meeting will be still keep running. And if doctor happens to go and see another patient, then it is going to say doctor cannot start another meeting. There is one more session running. So when you are in the video consult, get the video consult done, click end meeting, and then move away from that screen. And you can catch up on the documentation later. And then those are the evaluation management codes and everything. You can do the coding, you can use the My Notes. If you want to have the customized progress note, we are here to help you. You can let us know what template you want. We'll be able to format it for you. So I think that's all for now. So I'm going to give this to Kristen now. Let me go ahead and minimize and go back to the presentation. Kristen, over to you.
Thank you, Citi. So on the first slide, we have a sample CMS 1500 form. Like Citi had said, as long as you have the location set up, the place of service to will automatically pull forward on the billing side. And then in box 32, the location is going to be the location of the provider. So you want to make sure that location matches where the provider is sitting when they're doing the telehealth visits. Next slide. So a lot of insurances this week and last week have modified their guidelines on telemedicine. Currently, the insurance is allowing telemedicine during COVID-19 include Medicare, Cigna, United Healthcare. A majority of the Blue Cross Blue Shields, although it is state specific, so we still recommend just checking their website and making sure that you're good to go. Aetna, TRICARE, and Humana. If you have any local HMOs or IPAs that you're a part of, they should have something published on their website as well that you can pull up and just confirm that they're also allowing telemedicine. Work comp is going to be state specific. An example would be California work comp. The DWC released something a few weeks ago saying that they're allowing telehealth. Again, you can pull that up on your state website just to confirm you can see work comp patients in your state. We have an example here of the Humana policy that was just released on March 23rd, where they're basically letting providers know that because of COVID-19, they'll be covering the telehealth. Next slide. For coding and billing, you, of course, place of service 02 is the most important piece. You're going to use your regular E&M codes 99201 to 215. For your commercial payers, you're going to want modifier 95. And for Medicare, they're requesting modifier CR, which describes an emergency or catastrophic event. Then you have your phone consult codes. This is for any patient who can do audio only. So if you have older patients who don't have a mobile phone that has a camera feature, or they don't have the laptop or internet savviness, you can do a phone consult with them in audio only. You'll also want to check your payer-specific guidelines on audio only. Some payers, example would be Medicaid of Texas, are still paying the regular E&M codes 99201 to 215 for audio only. You also have your e-visit codes, which are 99421 to 99423. These codes specifically have to be initiated by the patient, and they're done through the portal. So you're not actually on an interactive video with the patient necessarily. The patient initiates communication with the practice through the portal or email. The provider then either responds back to it via the portal, they might call the patient. So it's a communication back and forth between the doctor and the patient. It's also cumulative. So if you're having an ongoing conversation with the patient for the whole week, you would add the time up for that whole week. Next slide. This is more detail about the phone consult codes or audio only, which is the 99441 to 99443. They do have time specifications. So you'll want to make sure that if you are doing audio only, you have a tracker on the time. Although typically not all payers reimburse for this during COVID-19, they have lifted a lot of their restrictions on even the phone consult codes. Next slide. And then virtual check-in. This is a Medicare only code, so you cannot bill virtual check-ins to your commercial payers. These codes are G2010 and G2012, and they're separate from your telemedicine visit. It's basically an interaction between the practitioner and the patient to decide whether a remote visit is applicable for the patient. This is only for established patients. You cannot bill these codes for brand new patients to your practice. And then you also have the e-visit codes, which go from 99431 to the G2063 codes. Again, these codes have to be initiated by the patient, and it's for established patients only. Next slide. For telemedicine, if you are seeing a patient in the hospital, nursing care facility, you would use the same codes you're going to bill as if it was an in-person visit, but your place of service will be 02. Same thing for transitional care management, as well as your prolonged service codes. Next slide. G2061 to G2063 are non-physician codes. They are Medicare only. If you're billing a commercial payer, it would be the 98970 to 98972. These, an example of a non-physician healthcare professional would be a physical therapist. Physical therapists are not allowed to do telemedicine, and these codes are not place of service 02. So you would bill place of service 11 if the physical therapist is in the office. And this is, again, the communication between the patient and maybe the physical therapist over a patient portal where the patient is asking questions about their care. Next slide. Each state has their own guidelines on whether or not they allow telemedicine. We have a link here for state-specific guidelines if you wanted to confirm that your state is allowing you to do this. However, since COVID-19, a lot of that has been lifted, as well as the treating a patient within your licensed state. Some states are allowing you to cross borders right now. Next slide. So patient consent is still required. However, some states are allowing you to do verbal consent if you're unable to obtain signed consent via the portal. There are links to state-specific guidelines on the allowance of verbal consent. An example would be California allows it. Other states might not, though, so we recommend just looking up if you're allowed to do verbal consent in your state. Next slide. This is an example of an informed consent that the patient would sign. Again, if you have the patient portal set up, you would send this to the portal, the patient would read it, sign it, and send it back via the portal so it can be uploaded in their chart. It basically goes over their rights as a patient during the telemedicine visit. It also lists out what telemedicine is, any risks with telemedicine visits, and the patient would be authorizing them or authorizing you to see them telemedicine and that they understand everything. Next slide. Our last slide is about prescribing narcotics via telemedicine. Normally, this is a no-no. However, because of COVID-19, we're in an emergency situation. A lot of state medical boards have put out or released a statement on their website saying that during an emergency, you are allowed to prescribe narcotics or controlled substances via telemedicine. You can go to your medical board website, and there will be on that very first page information on prescribing over telemedicine. And then questions and answers. Thank you.
All right. Thank you so much, Siddhi and Kristen, for providing this detailed and step-by-step training on telehealth. And I hope the information will be very valuable to our attendees for a successful telehealth consult. Before we go on to question and answer session, I wanted to let everybody know that we had conducted training sessions last week also. So we have compiled all the question and answers in our website. So if you go on our website under telemedicine, if you click, we have 2 pages, one dedicated to telehealth general question and answers, and the other to telehealth billing. So you can find answers to a lot of questions on our website. So let's move ahead for the question and answer session for today. So the very first question, I'm able to see and evaluate some dermatological problems such as lumps, bumps, and have noted these under skin on my physical assessment. But this is not showing up on my progress notes. Can this be activated?
So yes, it can. So if you can please create a ticket from Resource Center, we will definitely take a look at that. And maybe there must be some tag issue, and that's the reason it is not showing on the progress note. But it is something related to configuration, and we can definitely help you out with that.
Okay. The next question, assessment and plan comes out as one big summary instead of having each assessment associated with plan for that assessment. Is that okay, or should they be documented separately as before telehealth?
I would say that should be okay as long as the data or content is there. But if you really want to split it, then there are few tags we have which will show ICD wise assessment and plan. So again, that is something related to configuration and we can fix it.
Thank you. So for Siddhi, the next one is a request if you can click on progress note so that one can see how the encounter comes over there.
No, I did not get that. So let me.
Do you want me to repeat? If you can click on progress note so that you can see how the encounter comes over there.
Oh, okay. So maybe I think they want to know if you go to the progress note. Let me go to one of the other chart. You can see my screen, right? So let me go here.
Mm-hmm.
So if I go to the progress note, I can go to the My Notes and click on these three dots, and I can bring my default progress note here, and then I can start editing that.
Okay. All right, moving on. Can you go over payment differences between different telehealth codes? Which one we should use, modifier 95 or GT?
So GT used to be a Medicare modifier. And when Medicare came out with Place of Service 02, you no longer are required to use modifier GT. 95 is going to be for all your commercial payers. So everyone but Medicare will use modifier 95. Because this is an emergency situation, you can use modifier CR for Medicare, which basically lets them know you're performing this during an emergency, just so that you avoid any denials. The payment would be the same right now as your usual E&M codes.
Okay. If the provider is located at home when doing telehealth visit, what clinic location do you choose when scheduling the appointment?
So I think that would just be your personal preference. The location would be telehealth though. So when they're booking the appointment, they would select the telehealth location, not one of the clinic locations.
Okay. I think next one, maybe Christine, you can take this. If the encounter is telephone only, would you use the modifier 95 or GT? Also,
no,
is
no
that only for?
modifier.
Okay, all right. And the follow-up of this question is also, is that only for commercial insurance that would need the modifier?
Well, no, none of them require a modifier for the phone consult codes. So you don't have to worry about a modifier on those codes.
Okay. The next question, should you document verbal consent for telehealth in progress notes?
Yes. So I do recommend at the beginning of the progress note, there be a statement while you're saying this is a telehealth visit, patient's at home, went over consent, patient gave verbal consent.
Okay, the next one is again on billing. If the insurance does not cover, can we still bill the patients?
Yes, I mean, as long as the patient is aware that they're going to be billed and they've made an agreement with you. Most of the carriers, though, are covering right now. Unless you're at a network, and then you would just follow your normal out-of-network guidelines.
Okay. If the patient initiated contact through the portal and just needs a prescription, then can that be billed as an e-visit?
I do not recommend it, no.
Okay, all right. The next question I can answer, can we get the slides for this program? Yes, as I said earlier, after the webinar, we will have the slides as well as the recording. They will both be in our resource center and we will share with all of you via the email. The next question is, can we get copy of informed consent form?
Yes, yes, we can. You can. So if you would like to just go ahead and create a ticket from Resource Center, and then we can provide some samples. You can also look up some samples on the internet, and then we can customize one for you.
Okay. Moving on, if I conduct audio video encounter, which CPT code do I use?
So you would, if it's audio and video and you're using like Zoom, you would use your regular E&Ms, the 99201 to 99215.
Okay. So the next question, who makes the appointment for a telemedicine visit? Is it the patient or the staff?
So in current situation, staff would make an appointment because they're not going through the portal. So staff would make an appointment, but later on, if you have your own app in app stores or Google Play, then there is a provision that patient can create an appointment directly.
Okay. The next question, will the system keep account of time on the telemedicine visits, or must the practitioner track it and manually enter the notes?
So currently we recommend you tracking it, but we are thinking about it, how to do it, because that has been one of the most commonly asked questions. So our engineering team is looking at it, how we can get that tracking automated. But if you log on to your Zoom, it does keep track of your Zoom session. So probably you may also want to take a look at the timing there.
Okay. And Siddhi, there's a request. Can you please review the custom appointment?
Sure. So what I can do, I'm going to go ahead and go back to the database in the training environment, and I'm going to go to the settings and configuration. So it is under code/drugs, and you see here custom appointment status. So there are some statuses which are system set, like no show, scheduled, arrived, which you cannot modify or edit. But on top of it, I can create few new statuses. So I'm going to go ahead and click add new. And then let me just come up with a status called phone consult done. Okay. And you have to connect, because it is a custom status, you have to connect it back with one of the system status. So phone consult done, that means the encounter is done, and encounter is done means patient is ready for checkout. So you can connect it with ready for checkout. So you can select that and save. And now this new status shows up. If you want to create another status, you have here, ready for clinical staff. So even if you want to say ready for nurse or somebody, so instead of clinical staff, you want to say ready for nurse. So you can mark here ready for nurse. So that is a custom status, and you can connect it to the ready for clinical staff as a system status. And then those statuses are shown on the workflow here. Oops, sorry, here. It is not going to that appointment. And my new status is here. Yes, Tia.
Yeah. So the next question is, are new patient visits paid by commercial insurance?
So that's state specific as well. So be careful when you're establishing a patient relationship. You need to look if your state allows you to establish a patient visit. And we did have a webinar we did about a week and a half ago that is available on our resource center that has linked to each state or links to each state. And if they allow you to establish that patient-physician relationship over telemedicine, you'll also need to make sure, if your state does allow it, that you have a way to confirm the patient's identity so that they are not saying they're someone else.
Okay. The next question is again related on CPT codes. Are the CPT codes 99441 to 99443 Medicare payable?
So typically, no, they're not. However, I mean, most commercial payers wouldn't even pay it before. But because of COVID-19, a lot of those restrictions have been relaxed or lifted during this period. So the commercial payers are allowing you to bill for audio only phone consults.
Okay. The next question is, can we see new patients by telehealth?
So same answer, check your state guidelines on establishing that physician MD visit. Each state's going to have their own rules on how to establish that relationship. So you'll want to make sure you just follow your state-specific guidelines on that. And then again, verify the identity of the patient.
So the next question is, do you need a camera if you're using a regular computer?
Not if the computer has a camera.
Mhm. The next question is, when patient registers, can they document their medical conditions and medications?
Yes, they can.
The next question is, how do we obtain the COVID questionnaire?
So you can create a ticket from our resource center that you want to add the COVID-19 questionnaire to your database, and we can quickly import it for you.
Okay, and I think this question is answered. Can we still collect copays for the visits?
Yes. So for some of the payers, if the patient has a COVID-19 diagnosis code, they're waiving it. If the patient is being seen for something unrelated to COVID-19, then you would still collect your normal copays.
One more thing I would like to add to that, copays can be billed later as well. So during the telemedicine, if patient couldn't pay the copay, you can always bill it later.
The next question is, if the provider is at home for telehealth, how do you enter home address in box 32?
So if you have the billing module turned on within Prognosis, if you go to the billing side under settings configuration, there's the location. You can go into the telehealth location and switch the address.
So the next question is the same. Are the same physical exam requirements stand if not done via telehealth visit?
I think I understood the question. So you would want to document a physical exam if you can, or as much as you can. That being said, you can check the patient's appearance through the camera. Can they bend over? You could have them even push on their own stomach to tell where it's tender. So it just depends on their diagnosis and if you feel it's appropriate for them to self-exam.
Okay. Let's take a few more questions. So the next question is, can you elaborate on how to bill for audio only phone calls?
So audio only, again, you can either use the phone consult codes, no modifier. Some insurance carriers, though, during this period and them realizing that a lot of patients might not have a phone with a camera, are allowing you to bill the regular E&M codes with a modifier for audio only. I can try to pull together a list of those payers and attach it to this webinar so that you have access to it when Dia sends out the slides.
Yeah, thank you. Can you bill for remote assessment, and does this require a modifier?
What? Say it one more time. I'm sorry.
So can you bill for remote assessment? Does this require a modifier? Billing for remote assessment.
You can, and I would use modifier 95.
Okay, something again related to modifier 95. This question, when do you use modifier 95 for California OMFS fee schedule?
So for California work comp, you definitely want to have modifier 95 right now on all of the work comp claims.
Okay, moving on. Does box 32 have to say telehealth or the address of the facility of the physician? Or
So
box 30?
You would want it to say telehealth as like the location name. And then the address is going to be wherever the physician's sitting while he's doing the visit.
Okay, let's take 2 more questions. So the next question is, can we bill for a physical therapy through telehealth?
No, unfortunately, physical therapy is not allowed. I do know that ACTA is trying to fight that, but as of yet, you cannot bill that.
Okay. The last question is, can we use a different telemedicine other than Zoom?
Yes, you don't have to use Zoom Pro. You can use outside interactive audio video systems. I do know Trump, when he lifted everything with Medicare on March 17th, also made a comment that if a doctor used, FaceTime, they weren't going to impose the HIPAA violations on them, but I would still be cautious about HIPAA. So you want to make sure whatever mode you use to video chat with the patient has some type of HIPAA compliance.
And Zoom Pro is HIPAA compliant, and we have integrated that with Prognosis, and we also have a business associate agreement with Zoom. So you are kind of covered, and we also have a business associate agreement with our each customer. So probably there is an advantage of using Zoom.
Okay. Thank you so much, Kristen and Siddhi. Those were all the questions for today. And I would like to remind our audience that we will share the PowerPoint slides from today's presentation. We will also share the video, and we will also have the question and answers over to you in the next 1 or 2 days. All these materials will be available for future reference. So thank you all to all my attendees also for taking out the time to be here with us for today's session. With that said, it's bye from all of us here. Thank you.
Thank you. Thank you, everyone. Let us know if you have any questions. We are here to help you.